This is Dr. Mahalaxmi Iyer, proprietor Balaji Healthcare, and now I will tell you the story of how all this came about. When I was young, I always wanted to be a doctor. So finally, I happened to get to become a doctor, and I got an opportunity to take care of a hospital in 2002 at Kopar Khairane. It was at that time Balaji Healthcare was born. So this was in Navi Mumbai. And this hospital had only 4 patients, elderly care patients. The rest were the routine patients. Now these elderly care patients' relatives, they would always come and tell me, would you take care of my brother? Would you take care of my sister, my mother-in-law, my mother, my father? So at that time, I just thought, why can't we take care of them? So finally, I started hunting out for a place. Since this place was in the city and my elderly care could not come out and enjoy the beauty of the outside surroundings. So, Balaji Healthcare at Vasan was born in 2011 and it was constructed in 3 plots. We started looking out for an elderly care home in 2009. Finally, we came to Vasan and realized that this place was very scenic, beautiful. There was a river, Badsai, going along, and then there was a train. The building from where I got the view, there was a train going and there was a river to one side and greenery all around. And I decided that this was the exact spot where I wanted to build this elderly care home. So we started off in 2009. The thought was like we'll start it only on 1 plot. But finally my developer convinced me that you will have to take 3 plots and build a 100-bedded hospital. So we went ahead, built one, and this whole thing started in 2011 in Vasan. Initially, we had very few patients. Since we had very few patients, it was difficult for us to manage the show because we had taken loan from the bank, and even to give back the EMI was becoming difficult. Somehow we dragged along until 2014, where the crunch was too much. We had to actually go ahead and ask our friends to help us out. Fortunately, we got one very good person and he helped us out with some donation, and we could come out of the NPA status to which we had gone. In 2017, after I got this Mumbai Heroes Award by Mumbai Mirror, which had given me this award, we got a little more influx of patients and we got a lot of recognition because of that. So there were various papers which wanted to come and take interviews. So all that happened, and now let me come to the place where what I exactly do here and why Balaji Healthcare is different from any other elderly home. Balaji Healthcare basically also has a medical background, so that is why we can take care of the patients completely. So anybody would definitely think if they had some old patients, now what if I were to have a hospital also in my house only, how well I will be able to look after my parents. So this is exactly what Balaji Healthcare is doing. What we do is, we not only give them food and give them entertainment, take care of them completely, right from giving them bath and clothing them, getting them down for these activities, and if they are handicapped, then we put them on a wheelchair, and if they can't eat food, they are fed. Everything is done by my 90 employees. They are divided into Maushis and Mamas. The Maushis are for the females and Mamas are for the males. So besides this, what else we do? I have a nursing team also. So what this nursing team does is, so they go like a hospital. Every day they take the blood pressure, the temperature, pulse, everything about from a patient. And in case we find that the patient has fever, or we find that he is coughing, or we find that he is breathless, so we immediately take care of these initial problems so that he does not land up into the ICU, which used to happen to these patients when they were home. There were so many cases where a patient had to be hospitalized every 2-3 months, and that too in an ICU. So those were the times their relatives started hunting for a place which also takes care of their patients medically. And this is what Balaji Healthcare does. So what we do here is, we not only have this ICU, we also have a dialysis unit where even if they have a kidney failure, the dialysis is also done. Then the third part comes as a dental. you realize that when patients get old, they have problems with their teeth, they need dentures, and we have to do repeatedly certain alterations with these dentures. So that is done by the dental department, which is there in Balaji Healthcare, Vasan. Similarly, even for their eye, we have an ophthalmologist who comes regularly, and we have just recently thought of starting an OT for these cataract operations. So my patients need not go to any other place, and we could do everything under one roof. Now let me cite some examples as to how we do the medical care. Now there was a patient one who suddenly developed a stroke. So we had to immediately do everything necessary for her. We did everything, and once she started becoming better, say about 15 days later, it was only then we decided to take her CT scan, because shifting her and doing a lot of things would have really not helped much. So this is what we decide and we do it. Similarly, a patient fell down and then she had a problems with her wrist, that was a Colles fracture. Now our orthopedician, though we have an OT and orthopedician do come, but during COVID times it was very difficult to convince the orthopedics to come here and do the surgery at Balaji Healthcare, Vasan. Therefore, I decided to shift her to another hospital, Jupiter Hospital, and the initial deposit, whatever had to be done, was footed by Balaji Healthcare. The relatives were informed about this. The operation was done. So this is how we do a complete job. Once anybody leaves their patient with us, we see to it that we do not bother them unnecessarily. We take care of them completely. We try our best not to disturb the relatives. So small things we tell them on WhatsApp what is happening to the patient, and if major decisions are to be taken, we inform them and go ahead with the things. We do not wait for them to give the deposit or give the money which is necessary to take our patients to the necessary hospitals. We do everything by ourselves, and later on the relative refund it or they reimburse the amount to us. So this is how we would like to say that we are different from any other elderly care home, and basically this is being run by a medical doctor, and this doctor knows how to take care of the patient completely. So physically, mentally, spiritually, in Balaji Healthcare, the residents are taken care of completely. And we do have some people to vouch for it and tell us that they are very happy to stay here, and they would definitely tell the other people whom they come across that they should consider putting their elderly patients here. Let me talk about the other facilities which we have besides the medical facilities. We have about 70 patients now, so they all need diapers. Now all these diapers have to be burnt in a proper way. That is why we have an incinerator which directly burns it and takes all the smoke up, and it doesn't spread it down so that the other residents in the other buildings do not get affected. The next is we have a generator. This generator is a backup because this is a semi-rural area. So that is why there is a lot of load shedding, and whenever this load shedding happens, and my patients, if they are in the lift, and they would be really claustrophobic and they would be literally scared. So that's the reason we kept a generator as a backup. We have lots of festivals which we celebrate, and we get all our patients down, and they are very happy to participate in these festivities. The other facilities which we give is, we've got a laundrette now, by which it is an industrial level where all their clothes will get dried. We had to get this laundrette, and it has proved to be really very helpful. We have also solar. So half of our electricity is taken care of, or the power, by the solar panels, and our electricity bill also comes down because of this. So these are the environment friendly things which we've been doing, and we try to improve ourselves continuously. Even now, for the plastic waste, we give it to a person in town. We take the whole lot of plastic waste, that is the milk papers and all that, and give it to those people so that they can do whatever they have been doing, and this doesn't get wasted around here. In case we receive any complaints from the patients, so we immediately look at the CCTV footage, and if we also agree with the patient, then we take necessary appropriate action so that the same thing does not happen again. We have in-house cooking facilities. We've got about 6 cooks. So this takes care of the food of all our patients, and according to the different diets which has been recommended to them, we cater to that. Mostly our diabetic patients are given chapatis and we do not give them rice. And at other times, there are some patients who cannot bite. Therefore, we crush the food and give them in case patients are on Ryle's tube. So, we make it liquid and give the food through the Ryle's tube and see to it that the patient do not starve. Now, let's come to the last part where we are thinking about the growth. Frankly, I am thinking about having another center for the autistic children, be it in any spectrum, and especially for children who have become adults, that is, since the adults do not have any place to go. So we decided that we should be having something for them, similar to our elderly care home, where we can do a complete care of them, including their medical, their food, and their residential, everything put together, and also try and rehabilitate them. There may be some who may be good at various things. So accordingly, we will have to pick that out and then see even if they can earn something. If they were to earn, they would definitely feel very happy, and we would like to see that. If you have a loved one, young or old, who needs constant care, please visit us so we can help you.